Welcome back to another episode of Med Madness, where we delve deep into the intricacies of medical education and preparation for the USMLE. Today, we're focusing on an essential topic for any healthcare professional, teratogens in pregnancy. Understanding these harmful agents is crucial for safeguarding fetal development and ensuring healthy pregnancies. Let's explore some common teratogens and their impacts. First, let's discuss fetal alcohol syndrome, commonly known as FAS. FAS occurs when a fetus is exposed to alcohol during pregnancy. The hallmark features of this condition include microcephaly, which is a smaller than normal head size, and midfacial hyperplasia, where the midsection of the face appears underdeveloped. It's important to note that while these characteristics are prominent in FAS, cleft lip or palate is not typically associated with this syndrome. Moving on, let's consider fetal Hydantoin syndrome. This syndrome arises from in utero exposure to antiepileptic medications such as phenytoin, carbamazepine, and valproate. These medications are known to cross the placenta and affect fetal development by reducing folate levels and increasing oxidative metabolites. Children with fetal Hydantoin syndrome often present with cleft lip and palate, a wide anterior fontanelle, and distal phalange hyperplasia. Cardiac anomalies like pulmonary and aortic stenosis are also common. Additionally, neural tube defects and microcephaly can lead to developmental delays and poor cognitive outcomes. To mitigate these risks, it is vital for patients who require antiepileptics during pregnancy to be on the lowest effective dose for seizure control before conception. Furthermore, starting high-dose folic acid supplementation, 4 mg prior to conception, can significantly reduce the risk of congenital malformations. Next, let's explore the effects of substance use during pregnancy, beginning with cocaine. Cocaine use is associated with serious complications such as preterm delivery, abruptio placentae, and fetal growth restriction. However, it's important to clarify that cocaine use does not typically result in congenital defects. Another critical class of teratogens includes ACE inhibitors and angiotensin II receptor blockers, or ARBs. These medications, often prescribed for hypertension, can cause significant fetal harm if taken during pregnancy. They interfere with angiotensin II, which is essential for fetal renal development and the maintenance of the fetal glomerular filtration rate. Prenatal exposure to ACE inhibitors, or ARBs, can result in fetal renal failure and oligohydramnios, a condition characterized by insufficient amniotic fluid. This, in turn, can lead to pulmonary hyperplasia, growth restriction, and limb defects, collectively known as Potter sequence. Ultrasound findings often show small, underdeveloped fetal kidneys and a minimal amount of amniotic fluid. To prevent these adverse outcomes, women of childbearing age should ideally avoid starting on ACE inhibitors or ARBs if alternative treatments are available. Those already on these medications should discontinue them before becoming pregnant. Let's bring this discussion to life with a real-world case study. Imagine a 28-year-old woman with a history of epilepsy successfully managed with phenytoin. She becomes pregnant and, without proper prenatal counselling, continues her medication. At her 20-week ultrasound, her fetus is diagnosed with a cleft lip and palate, along with distal phalange hyperplasia and a wide anterior fontanelle. Recognizing the signs, her healthcare team identifies fetal Hydantoin syndrome. Fortunately, they promptly adjust her medication regimen and start her on high-dose folic acid, helping to mitigate further risks. In summary, understanding teratogens and their effects is vital for ensuring the health and development of the fetus. From the risks associated with alcohol and antiepileptics to the dangers posed by cocaine and certain antihypertensives, healthcare providers must carefully manage and counsel their patients to prevent these harmful outcomes. Thank you for joining us on this episode of Med Madness. Stay tuned for more in-depth discussions on critical medical topics. Don't forget to subscribe and share this podcast with your peers. Until next time, stay informed and stay healthy.